Hi, and welcome to Fairview Range Focus. I'm David Hall, Chief Administrative Officer for Fairview Range. In this weekly or monthly program, we talk about health topics that affect our community, and today we're going to talk about ENT services, and I'm joined by Dr. Fredrickson and Dr. Schinkel, both ENT specialists, and we're going to talk a little bit about ENT services and what that is about. A lot of people know about ENT services, but many people don't, so hopefully we can educate everybody today. So maybe we could start by talking about just the real basics. What is an ENT specialist?
ENT is ear, nose, and throat. Basically, it includes any type of medical problem or surgery that addresses the neck up. So ear tubes, tonsils, adenoids, thyroid surgery, nasal and sinus surgery, skin lesion and skin cancer removal, reconstruction after the removal. As far as facial plastics, we do closures of wounds, closures after removal of skin cancers, and then allergy. We have an allergy department. So we do skin testing, and we offer allergy immunotherapy.
Okay. So, Dr. Schinkel, tell me about, I think you're both, as I understand, both board certified.
Correct.
Right.
What does that mean?
So what that means is not only are we going through medical school and our 5 years of residency after internship, but then there's also special testing that we requires specifically for ear, nose, and throat.
Okay. And so that sounds like a test.
Correct. It's
Okay.
actually a two-part test.
Okay.
One is a written portion, and then a second is similar to this type of situation. It's an oral examination where we are tested by one of our peers.
Okay.
And to our knowledge base.
Okay. And how is that once you're certified, you have that certification for a number of years before you have to recertify. How many years is that?
Right. It's 8 to 10.
Okay.
10 years is what's typically quoted, but I just retook mine at year 8, so my recertification is good for now 12 more years.
Okay. So being board certified is a big deal, and is
Yes.
it something that comes easily, I take it? Yeah.
Correct.
All right, great, good. So if someone needed to see you as an ENT specialist, do you need a referral? Do you make an appointment on your own, or how does that work?
So a lot of that is based on the insurance companies and what their patterns of requirements are. A lot of times what you can do is you can check with your primary care provider and find out from either their office or your insurance company. We do certainly accept self-referrals, but some of that is based on your coverage.
Okay. All right, very good. So probably be a good place to start would be an individual's primary care physician.
Yes.
Right.
Okay.
Or you can just check with your insurance provider directly.
Okay.
And call our office.
Okay. Very good. And now, Dr. Fredrickson, you spoke a little bit about some of the types of procedures you do. I guess maybe you could talk a little bit more in detail. What would you say are most common procedures that you do?
Sure. Ear tubes, tonsillectomy, adenoidectomy, nasal and sinus procedures. So straightening crooked noses, broken noses, sinus surgery. Those are very common. Skin lesion removals. And then neck masses and thyroid surgery.
Okay. And the age of your patients, does it tend to be young, old, or how does that vary?
It ranges from everywhere between 6 months of age to 100.
Okay.
Right. All walks of life. And we see babies in the newborn nursery for certain conditions. We treat families. We have a lot of families that are our patients. We see the kids, the parents, the grandparents, so it's a great specialty.
Okay.
Yeah. You get a wide range of age groups, and that's what makes it special.
Okay. I bet. So you mentioned tubes in children, and I think that's something that a lot of people have curiosity about because they hear tubes in the ears and think, well, what does that mean? And I picture a tube that's pretty large, and I'm pretty sure that's probably not the case. So could you talk about that, Dr. Schinkel, a little bit?
Sure. What an ear tube is actually a small, very small, about the size of the end of a pen.
Okay.
As far as the, I would say almost microscopic size in comparison to what you would think of as far as a tube. And what they're there for is to actually help solve a problem called eustachian tube dysfunction. And what that process is there's a special little ventilation system in our ears that isn't functioning properly. And so what the tube is doing is temporarily allowing that to function. And the hope is that the underlying condition will then go away to a point where that tube will then not be needed anymore.
Okay. And that's typically done with children. Is it ever done with adults?
Absolutely.
Yes.
It is.
Probably a quarter of our patients are adults that need tubes.
Really?
Say around 25%.
Okay.
The difference is one can be done in the office and one
I see.
is much more suited for the operating room.
I see.
Most adults, some older teens we can do in the office, children in the operating room.
Okay. And the tubes themselves, does an individual who has that, do they have to come back in to have them removed at some point if the problem resolves itself, or how does that work?
They almost always fall out on their own.
They do.
Without anyone really noticing it. So between us checking their ears, the primary care doctor looking at the ears for routine exams, they tend to come out on their own, and then almost always the eardrum heals up normally. And then we reassess how the patient does without the tube. They might need another set of tubes. Not always.
Okay.
They tend to stay in. I always give the range 6 months to 2 years. It just depends on a lot of factors.
Yep. And we've got some new guidelines that say as much as 3 years before you really need to get interested in removing the tubes. But there are a variety of different types of tubes. So just saying you have tubes in your ears doesn't necessarily mean that they're all exactly the same. Okay. There's quite a large variety of different types. So different providers and different ENT surgeons will place different types of tubes, and for different reasons. So some are made to stay in, and in children they're usually about that time frame between 6 months to 2 years, where sometimes in adults we'll use ones that we want to last over 2 years and beyond. And again, for different reasons.
Okay. Now, you mentioned surgery in the sense of that pediatric patients, sounds like most commonly, would be done in a surgical setting. So is that done always in a hospital setting?
No.
Okay.
It's a very quick procedure.
Okay.
Generally 5 minutes or so after the child's asleep. And they just would have a mask, general anesthetic, so there's no endotracheal tube. There's not a tube put down the throat for kids during surgery. There's no IVs that need to be started, so it's very quick. So it certainly is perfect for a surgery center, ambulatory surgery center setting.
So, and we've talked about the Northwood Surgery Center on this program before, and that's located in Virginia. And as I understand, both of you are going to be offering services there at some point?
Correct.
Okay.
Yes.
So that's a procedure that would certainly be suited for that environment, very outpatient related. Then the day surgery is often referred to then. So.
Right.
Okay. All right. Very good. Is there other procedures that you're doing on children? You mentioned adenoidectomy, if I pronounced that correctly. Maybe you could speak about that a little bit too.
Sure. What an adenoidectomy is tonsil-like tissue that sits in the back of the nose. And a lot of times we find that to be a cause, or at least contributing to, certain problems with the ears as well as the nose, meaning it could block that eustachian tube that we mentioned earlier, but also it can block some of the drainage pathway for the nose. And removing that not only can help with the ears and that function as well, but also how well their nose functions, and it will improve nasal congestion or stuffy nose, as well as allergies and other types of reactive airway conditions.
And is that done on all ages as well, that type of procedure?
Usually it's done more in children.
It is, okay.
Essentially, you are supposed to grow and develop in such a way that the adenoid tissue will shrink and go away, but we have found that that's not always the case, and so it does sometimes leave itself to young adults and even as much as middle-aged adults requiring that tissue to be removed.
And we find a lot of adult patients who have chronic irritation to the back of the nose from allergies, smoking, some immune problems tend to have big adenoids. But almost, all of our patients are children. Like Mary said, Dr. Schinkel said, adenoids are supposed to involute and just kind of go away on their own between 9 and 13 years of age. But we see at least once a week in the office, if not more often, adults with big adenoids.
Okay.
Yeah.
So
Absolutely.
they could be that could be treated as an adult as well.
Oh, sure.
Sure. Okay.
Yep.
All right. Good. Also, and I know that allergies this time of year is common for a lot of people. They're dealing with pollens and different things, and I know that you have a fairly busy allergy clinic. Maybe you could talk a little bit about that as far as what exactly is that involving and what kind of patients that you treat and so forth.
Well, our clinic is basically staffed by nurses, and Dr. Schinkel and I are the physicians in charge of the clinic. So you would come in and have a consultation with us, and first of all, we'd decide whether or not you needed to be tested. And we can do a blood test for allergies. Skin testing is a little more accurate, and that's generally what we prefer if we have a high suspicion that there's allergy and we think the patient would be able to withstand skin testing. And it's just little pricks on the back and the arm, and then we can review what the patient's allergic to and work on avoidance measures. And if necessary, if the allergy symptoms aren't improving with medication, such as antihistamines, so that's Claritin, Allegra, Benadryl, then we might think of starting allergy shots or sublingual therapy, which is a drop under the tongue to help treat the underlying cause of allergy.
Okay.
So shoot away. This is a big topic.
Right. The whole idea behind any kind of allergy therapy is that you're trying to stop the process that's making you have a stuffy, runny nose, sneezing, itchy eyes, and everything that goes along with what we would consider to be allergies. And so what you plan for and what we're testing for is not only the grasses, trees, weeds, molds, but cats and dogs and dust mites and horses and other things that are really common for this community and this environment. And so to find out not only what you're allergic to, but how allergic you are to it, so that we can kind of tailor specifically for you the treatment that you'd need.
So is there a point that, as an individual, that, I mean, everybody sneezes on occasion, I would guess. Is there a point when you could kind of say, boy, I really should have this evaluated and maybe, be tested? Or is there a certain symptoms that an individual could be thinking about? It's like when it gets to a certain point at all, or is it just vary that much?
Well, I think if your primary care physician feels that you've been seen and treated with a number of medications and you're not getting better, that would be time to see us. If an individual feels like their allergy symptoms are really interfering with their quality of life, so are they stuffy every day? Does it matter the time of the year and their nose sprays aren't working? Is it causing them chronic sleepiness, even sleep apnea, where they're not breathing and stopping breathing at night? And it becomes a cost issue too. A lot of patients spend a lot of money on over-the-counter medications and they don't know what they're treating. So we might be able to help someone know, is this allergies, is this sinusitis, is there a structural problem in the nose? Maybe your nose is crooked and you could be spending a lot of money on medications that aren't helping.
Okay.
Yeah, absolutely.
So you mentioned crooked nose, and I know that noses get broken, and sometimes that affects one's nose and sinus and breathing and whatnot. Is that something that can be corrected? Does it need to be corrected? Do you treat that at all?
Sure. Basically, you're looking at how much of a blockage that you're experiencing. And a lot of it goes on the symptoms in which the individual presents with. So certainly if it's causing you to not be able to breathe out of side of that nose, if it's interfering with your sense of smell and taste, there's certainly a reason to have it evaluated. And usually sooner is better than later when it comes to having your nose broken and getting in to be seen.
Okay. So as far as correcting that, if it was something significant enough, that is a surgical correction that occurs?
Yes.
Okay. So is that an outpatient as well? Can you describe that just a little bit?
Sure. Basically what you're doing again is trying to straighten out to the best of our ability and not only improve how it looks, but how well it functions. And that sometimes is a very quick procedure, and other times it's more in depth and will take longer due to the type of correction that is necessary. And that is, again, on an individual basis, and from our evaluation, what we would recommend going forward with that.
Okay.
But yes, typically it is a same-day procedure, and you would be able to go home and follow up as an outpatient.
Okay.
And usually when we generalize and say a crooked nose, there's the outside appearance of the nose called the dorsum, and then there's the internal parts, the septum, the turbinates, and that's really what most people have never seen. So when they come into our office, we can show them that anatomy. And a lot of patients, the outside of the nose is really okay. It's the inside parts that are crooked. And that procedure is called a septoplasty, and it usually would be done with a turbinate reduction. That just means getting the inside nose clearer. And that is almost universally outpatient.
Okay.
Yeah, and you're not going to be bruised.
Mm-hmm.
I think there's a lot of misconceptions about nasal surgery based on the way things used to be done in the past.
Okay.
And generally, not every patient, but there's not generally a lot of packing anymore. And if there is, it's usually taken out within a week.
Okay. And
Yeah, absolutely.
those are all outpatient procedures, you said?
Almost always,
Almost always. Okay.
unless the patient is just otherwise not very healthy.
I'm curious if, is that something that, as individual have, I suppose it depends on to the extent that they're, the disorder, the deviation of the septum or whatever, as far as how much impairment there might be. But is that something that after the surgical procedure that you sometimes find patients that say, wow, what a difference? Can it make a real difference in a person's life or their breathing? And
very much
Sure.
so.
Okay.
Yeah.
And we wouldn't recommend it. We wouldn't recommend surgery if we didn't feel it would help them.
Yeah, and we get some great results. Obviously, it's not going to be the next day.
Yeah.
You're going to have to wait for the swelling to calm down over the next week to 2 weeks. But it's been as dramatic as not having a sense of smell to getting it back after this procedure.
Okay.
So it can have very dramatic results. And overall, most people are very happy with the procedure. So.
And this is a procedure that would be covered by insurance. The type of nasal procedures that aren't covered are purely cosmetic. So that's a different type of surgery.
Okay. We just have a couple minutes left, and one of the topics I think there's a lot of interest in the community has to do with hearing loss. And I know that you both have some involvement with that. Maybe you could speak to that as far as what kind of services or involvement you have with patients that are suffering from hearing loss. Could you start, Dr. Fredrickson?
We're the hearing doctors,
Okay.
so we take care of hearing loss due to all causes. So in kids, it's more commonly from fluid in the ears, although there are children born with hereditary causes of hearing loss or other causes that are present at birth. So we have an audiologist, Gwen Washburn, who is excellent. She's been here for 8 years. So we would evaluate the patient, have a true test of hearing, and for patients who meet criteria for hearing aids and that we think would benefit from hearing aids, Gwen Washburn would help recommend and provide them with hearing aid use. If it's something surgical that could be corrected to improve their hearing, such as tubes to drain fluid or help the eustachian tube dysfunction, or a hole in the eardrum we could repair, then we would do that as well.
Okay.
We've got a great hearing aid service and wonderful individuals that are very helpful and will take really good care of anyone that walks in their door.
That's great.
And our audiology department is associated with us as ENT physicians. So, you know, our patients know that they would never be sold a hearing aid that, you know, wasn't medically recommended to them. Gwen wouldn't recommend a hearing aid that was not appropriate because they are an investment and we want people to be happy.
Right. Great. Well, that's a great point. The time went by quickly. I think like ENT is something, certainly there's a lot to talk about. There's a lot of involvement. As you said, I mean, it's not just children, it's adults, it's the whole family that really has the potential to benefit from the services that you offer. So, lastly, if one was going to make an appointment to see either one of you, how would we do that?
Sure. Call the office and talk to one of our very friendly schedulers, and they'll get you set up with not only the appropriate length or appropriate time frame in which you would need, but also direct you if there was any information that they may need or that may be helpful for us that we could gather prior to the visit that we could really use. And they'll help get all that information collected for us.
Okay.
And that's a very important point that Dr. Schinkel made. Any paperwork that the patient can help get to our office from primary care is very helpful to us. So, and also we have a physician's assistant who's excellent, Tara Eskelson. So she also sees patients and sees a lot of our post-operative patients, and she's very good.
Great. A good team, sounds like.
Yes.
Yeah. And if I'm not mistaken, I think that number that they're to call is beginning scrolling on the screen, so hopefully that's available for people to see as well. So, well, that concludes the show for today. And I want to thank Dr. Schinkel and Dr. Fredrickson for joining us, and appreciate your involvement, your expertise, and for you being part of the Fairview Range Mesaba Clinic. For more information on the services that Fairview Range offers, you can visit our website, and I believe that's also on the screen, but range.fairview.org. And so please watch next month for more Fairview Range Focus. Stay well, and thanks for joining us.